Assalamu alaikum guys, the next video is about ulna. Ulna is the medial bone of your forearm, and as it is a long bone, it will consist of an upper end, a shaft and a lower end. The peculiar feature of this bone is that its head lies on the lower end. Most of the bones or long bone have their head on the upper end, but ulna is peculiar about this, and it has its head inferiorly, forming the lower end head and the styloid process, which is postomedial. Moving forwards, if we see the upper end has two processes. This is the snake-like opening, like snake, the mouth of a snake, opened mouth of a snake. This, first of all, this process is the olecranon process. This is the trochlear notch, and this one is the coronoid process, and this one is the radial notch for the head of the radius. Now moving forwards, if we see the olecranon process, it has a superior surface. This one is the superior surface, which is triangular, and anterior surface. This one is the anterior surface, which forms the upper border of the trochlear notch. Then there is the lateral surface that is continuous with the lateral surface of the shaft, and there is a medial surface which is continuous with the medial surface of the shaft. There is also an posterior surface, this one, which is continuous with the posterior surface of the shaft. There are 5 surfaces of olecranon process: superior, anterior, lateral, medial and the posterior. Moving forwards, the coracoid process also has 4 surfaces: the superior surface, this one, which forms the lower border of the trochlear notch, and anterior surface, a lateral surface and a medial surface. The 2 important features of this coronoid process is that anterior surface forms a roughened area known as the ulnar tuberosity, and the lateral surface is interrupted by a notch, that is your radial notch, which forms the superior radial ulnar joint with the radius. Now moving forwards, if we see the shaft has 3 borders like it was with radius. This sharpest border is your medial sharpest border, that is known as your lateral border of the ulna. It starts from, this is the radial notch, and it ends in this projection known as the superior crust. So the interosseous border starts superiorly with the superior crust, and moving forwards downwards, it forms the head, the medial side of the head. Now if we see the lateral border starts from the medial side of the ulnar tuberosity, this one, and it extends downwards, forming the medial side of the styloid process. This is the styloid process, medial side of the styloid process of the ulna. Moving forward, the posterior border starts with the subcutaneous area, the triangular area of the olecranon process, and moving forwards, it goes downwards, forming the medial side of the styloid process. Both anterior and posterior border ends in the styloid process, and the lateral border, which is the interosseous border, ends in the head or forms the lateral surface of the head of the ulna. Now if we see the surfaces, the surface between the anterior and the interosseous border is known as the anterior surface, and the surface between the interosseous and the posterior border is known as the posterior surface, this one. And the surface between the anterior and the posterior border, this one, is your medial surface of the ulna. Now moving forwards, the lower end consists of 2 structures: the head of the ulna, this one, and this is the styloid process, this, and it lodges only one area. The surface of the ulna, there are 3 grooves for the extensor muscles of the forearm.